Hey guys, today we'll talk about atrial fibrillation. What is atrial fibrillation is? It's an irregular and often rapid heart rate that occurs when the two upper chambers of the heart experience chaotic electrical signals. The result is a fast and irregular heart rate. The heart rate in atrial fibrillation may range from 100 to 175 beats a minute. What are the causes of the atrial fibrillation is? First, we have to know that the exact cause of atrial fibrillation is unknown, but it's more common with the age and affects a certain group of people more than others. First, we may have the first cause of atrial fibrillation is high blood pressure, hypertension, atherosclerosis, heart valve disease, congenital heart disease, pericarditis, and finally cardiomyopathy. Diagnosis of atrial fibrillation. The diagnosis of atrial fibrillation is based on the physical finding of an irregular heart rhythm and is confirmed with an electrocardiogram or registrar. When atrial fibrillation is suspected during auscultation of the heart with irregular beats, obtaining a 12-lead ECG in the next step. And symptoms of atrial fibrillation: rapid and irregular heartbeat, fluttering or thumping in the chest, dizziness, shortness of breath and anxiety, fatigue when exercising, faintness or confusion, general fatigue and weakness. Treatment. First, we will start with non-pharmacological treatment by eating healthy foods, keeping blood pressure and cholesterol levels under control, maintaining health weight and follow-up care. Second, pharmacological treatment. If the patient has an atrial fibrillation with no other disease, so we'll use beta blocker and calcium channel blockers combination as diltiazem or verapamil with amiodarone. If it has atrial fibrillation and hypertension, so we will use beta blockers and diltiazem verapamil as a calcium channel blockers with amiodarone. The patient has heart failure with atrial fibrillation, we will use beta blocker plus digoxin with amiodarone. If the patient has chronic obstructive pulmonary disease (COPD) with atrial fibrillation, so we'll use beta blocker plus diltiazem or verapamil as calcium channel blockers, but please don't use amiodarone. And that is why, because amiodarone with chronic obstructive pulmonary disease may cause shortness of breath and other toxic side effects. Thanks for watching, and please don't forget to subscribe the video and like it. Goodbye.